Let's talk about these 9 principles. First one's commitment to excellence. How good do we really want to be? Do we want to be great? Well, we found that we wanted to be the best hospital in the country. Why? Because I think everybody should want to. July 29th, 1999, or 1994, my boy was in a campground and we were playing. His ball went into a construction site and my wife yelled for him not to go get it. But he ran in anyway because he couldn't hear, bent down to get the ball, and a guy in a 4,800-pound Bobcat ran on top of him and crushed him. Now, on July 24th, 1999, until 3 o'clock, our life was going one way. And by 3 hours later, we were an hour away. We were in our second hospital. We're in a pediatric intensive care unit, and they wouldn't tell us whether our boy was going to live or die. At that moment, how good do you think I wanted that hospital to be in Rapid City, South Dakota? See, I want every hospital to be good. Well, we think you got to be good in service, quality, cost, people, and growth. You got to be good in all of them. You can't just be good in service. You got to have clinical outcomes. You got to be financially, know what you're doing. You got to hold on to your people, and you want to grow. Never underestimate the difference you can make in somebody's life, even if they don't tell you. But I get lucky. I got told one day. When I was president of Baptist Hospital, I told all the employees that I had a 1.3 grade point. I told them I struggled in school. It didn't come easy for me. And I didn't think a thing about it, but I want them to know that just because you're a CEO or just because you're a doctor, because he is a doctor, guess what they think? You've had it made. You don't have these issues. And then if you tell people you don't have them, they don't share with you, and you can't help somebody. I tell about my 1.3 grade point. A couple months later, a lady comes up to me, an employee in the hospital, and she says, you know what? I was talking about you at home last night. You know what? We take people home with us, don't we? Well, I'm sitting there, and I say, what did you say? And she said, you know, my son, like you, has a lot of problems in school. She said, he's in second grade, and he's having a tough time. Now, knowing this lady, I bet you she had a tough time in school. I bet you it didn't come easy. But see, as a mother, she's going to do everything she can to be the best mother she can possibly be, and she's trying to help her child, every single night with his homework. She lost it the night before. She lost it, and she yelled at him. And all of a sudden, at second grade, he started crying because he couldn't do this work, and he started crying. And all of a sudden, what she did then is she tried to get him to quit crying, and he wouldn't quit crying. So finally, she closed the book and looked at him and said, listen, the president of Baptist Hospital didn't do very well in school, and he turned out okay, and so will you. People ask me sometimes, what was the best thing that happened my 4 years as CEO of Baptist Hospital? It was that. It was that, to know that you impacted one child's life. You know what? I would have never been able to do that if I didn't share that I struggled. Because, you know, that's the difference we can make. And that's the difference each one of you is going to make. Never underestimate the impact you have on people's lives.